Hi, my name is Lauren Pyers. I'm one of the occupational therapists for Easter Seals in Meriden, and I'm here today to discuss our current program for adolescents and young adults who have autism. Why have a driver assessment specific to adolescents with autism spectrum disorder? Well, either your child or someone you know may have social or behavioral deficits. They also may have difficulty with verbal or nonverbal communication, and it may also be challenging for adolescents with autism to bring multiple skills together, such as sensory processing, visual spatial awareness, social or motor skills, and executive function skills. As you can see on the chart here, there are multiple common comorbidities associated with ASD, also known as autism spectrum disorder. To name a few, it could be anxiety, ADD or ADHD, or someone who is having difficulty sleeping at night. Some common errors that may be made by drivers with autism are difficulty with visual scanning, speed management, lane maintenance. So are they positioned in the middle of their lane, or are they drifting more to the left or to the right of the lane? And lastly, adjustment to stimuli. So for example, increased stimuli in the city, moderately traveled roads, or busy parking lots and plazas, loud sirens, or even distracting music or focusing while people are talking in the vehicle may be a challenge. So let's talk about some evidence-based research. This is really what supports the need to have this specialized evaluation and training. Studies show that adolescent drivers who have autism are more likely to crash due to failure to yield to a vehicle or pedestrian and while making left turns or U-turns. Evidence also suggests that adolescents who have autism require extensively more instructional time to become fit to drive. In addition, research shows that it is important to speak with your pediatrician and/or behavioral health professionals about driving. Statistics show only 1 in 5 healthcare providers discuss transportation with their patients who have autism. And a total of 8%, which is few, felt prepared to assess driving readiness in patients who have autism. But only a quarter of providers will actually refer patients elsewhere. Driver licensing rates among adolescents and young adults with autism spectrum disorder who don't have an intellectual disability indicates that 1 in 3 acquire a driver's license versus 83.5% for other adolescents. Another statistic states 89.7% of those with ASD who acquired a permit were licensed within 2 years, and license-related decisions were made prior to acquisition of the permit. The takeaway is research highlights the need for individualization and specialized instruction, and the need for parental engagement to really support the learning to drive process. So how does all of this research translate to our program? The clinical driver assessment is beneficial in identifying if your child or an adolescent who has autism has the skills to drive and if they will be a driver. Here at Easter Seals, we want to increase families' access to tools to promote driving readiness, and we want to establish best practices that could help to enhance the standardization for this population to learn to drive. Our assessment consists of a clinical to assess cognitive, visual, and physical abilities. It will also include passenger activities, where your child is assessed to look at the big picture. This helps to provide more information related to their cognition and vision in the moment. At the end of the assessment, we will all then sit down together to discuss the recommendations and the next steps. So you might be asking yourself, who is providing these services? At Easter Seals, we have a CDRS which stands for Certified Driver Rehab Specialist, who is also an occupational therapist, and a CDI, Certified Driving Instructor, and a provider of low vision rehab. And we have an occupational therapist who is also a provider of low vision rehab and is credentialed as a DRP, which stands for Driver Rehab Professional, and is a CDI, Certified Driving Instructor. How do I get started? You can have your physician send a referral to Easter Seals. You can access our referral on our website, and the link to our website is on this page. And you do not need a permit to participate in this program. And lastly, I wanted to talk to you about some of the outcomes of the assessment. We may refer the client to therapy services if deficits are identified that we feel could be improved upon. We may provide referrals to other professionals as needed to address these deficits, for example, a vision specialist. The recommendation may also be to go ahead and obtain a permit, or it could be to proceed with driving lessons if someone already has their permit. In other cases, we may begin to discuss other modes of transportation and provide you with resources and recommendations that can help. It has been a pleasure to talk to you today about our program. If you have any other questions, you can contact Rachel Corbett. Her phone number and email can be found on this slide, and we look forward to helping you take this next step. Thank you so much for taking the time to listen today.